morning, everyone. So our goal as a company is better and faster control of major bleeding during surgery. Our device is called the MCTS, and my contact information is listed on the slide. So we know that each unit of blood transfused is associated with risks. The top of this slide summarizes those risks. There's a plethora of research showing that if patients are managed without transfusion or less transfusion, they do far better. The bottom of the slide summarizes a study of over 1 million patients. Patients who receive transfusion compared to those who don't have twice the risk of developing an infection and 70% greater risk of death. Our goal is to revolutionize the care of bleeding patients during surgery. And we know that at least 40% of transfusions are unnecessary. Some research says as high as 59%. We have a device with a harm margin consumable, and this is the instrument that already exists that has been used in a pilot study in heart surgery. We want to replace the top of the screen where a tube or several tubes of blood are sent to a lab, handled by numerous people. Results often take an hour, sometimes 2 hours, sometimes days. We want to replace that with the bottom of the screen, our instrument with a cartridge, and you get results at the point of care in approximately 10 minutes. We have world-famous experts who have given testimonials as to the value of what we do, that we are the only test that actually compares the results of the treatments that are available in order to stop bleeding. This is a display of what our test results look like. The green column is normal blood clotting. Existing tests say something's wrong with the blood. Ours is the only one that actually displays the efficacy, the ability of the available treatments to stop the bleeding. Our results on the right, you put a tube in the cartridge, and a few minutes later, you just look and see what's in the green column. That compares to the test guided algorithm on the left. This is an example of what is currently done. These algorithms can require as many as 10, even 15 decisions. They're cognitively challenging. And when a patient is bleeding, doctors don't have time to do these. So although there are some research studies suggesting they be done, in practice, they're often not. Our scientific advisors include leaders in the world in terms of perioperative bleeding and transfusion, as well as company team members. We are projecting revenue in year 4 of sales in excess of $70 million. This is based on just the first intended use in cardiac surgery, though other intended uses are down the road. Our current round investment terms, $840K is invested, 2.16 is available, and we are providing warrant coverage for this investment. And our goal is then to go on to a Series A. Several investment banks have provided term sheets to lead a Series A raise for us. Follow-on products after cardiac surgery, trauma surgery, and assessment of novel anticoagulants. We already have 3 generations of prototypes of devices and cartridges. We have data from a Mayo Clinic study confirming the problem and showing us how to improve our current system to be a commercial-ready system. Patents have issued in multiple locations. The most likely exit in this space is acquisition. It is common, and this is a list of potential acquirers. Thank you for your time. As mentioned, we're also holding a private event this evening, and at that event, there'll obviously be more time for me to present and a longer Q&A. Thank you for your time.